Good afternoon, everyone. Good afternoon. Thank you all for joining us for what should be an exciting conversation today. We do have a few more attendees joining, so we'll wait a few minutes for everyone to come on board. But we are excited to have you a part of this amazing conversation that should be an amazing. We have a wide array of health professionals from across different HBCUs across the country. So we should have an exciting conversation today. So we want to wait a few more minutes for everyone to join, but we had a great turnout. We had several attendees register. We had a few that will be coming on that did not register, but we want to thank you all again for joining us for this HBCU conversation in mental health in the age of COVID-19. So before we get started, we just wanted to thank you all for joining us today for this much needed conversation on HBCU mental health and the impact in the age of COVID-19. I think we all can agree that these past few months, essentially this spring semester, has created unprecedented challenges. The impact on our lives has created challenges that no one can predict, and especially for our students. Our campuses have become empty, and we all have been tasked with creating new initiatives and opportunities, by all accounts, to address our students' mental health and physical needs, both from a virtual standpoint and using telehealth options. In order to provide supportive services to meet the health needs of our students, our mental health professionals have had to transition and pivot. They've had to create telehealth options, telepromotion initiatives, and ways to continue to engage our students in the midst of these challenges that COVID-19 has presented. And in the midst of this transition, the mental health needs of our students have significantly been impacted now more than ever. Students are searching for answers and practical understanding of how to cope, adjust, and create some sense of normal when statistically we know that communities of color have been hit the hardest by this epidemic. HBCU mental health professionals are on the forefront and will have to continue to adopt and adapt to provide supportive services now more than ever for when our students return, hopefully in the fall on campus. And if not, we'll have to create opportunities to be able to engage our students from a virtual standpoint. So we are fortunate today to be joined by a group of dedicated HBCU mental health professionals from all over the country to provide their expertise and share experiences that are happening on their campus and discuss what their campuses are doing and ways that we can develop and trade and exchange different ideas across different campuses to better provide mental health support services for our students. So without further ado, I'll introduce our panelists today and we'll jump right into our conversations. So all of our attendees that are on, if you have a comment or a question for our panelists, please use the chat box that's located on your screen, and we'll do our best to gauge your question and engage you and allow our panelists to provide the expertise that's happening on their campus. So first, we're fortunate enough to be joined by Dr. Ray Lundy, who is the Associate Vice President of Student Health and Counseling from Wiley College, Dr. McFadgion, who is the Director of Interpersonal Violence Prevention at Howard University, Dr. Kennedy, who is the Director of Counseling Services from Tennessee State University, Ms. Tanisha Smith, who is the Crisis Prevention Counselor from Alabama A&M University, Dr. Barnes, who is the Executive Director of the Howard University Counseling Service, and Dr. Fluitt, who is the Director of Outreach from Howard University Counseling Services. And I'm Dr. Micah Griffin from the City University of New York, Kingsborough Community College in Brooklyn, New York. So thank you all again to our attendees who have joined, and we'll just jump right into this conversation. So I did want to allow all of our panelists to kind of give us some feedback or give us some insight to what's happening on your particular campus. So if you could just maybe take a few minutes and just tell us kind of some of the services you're providing right now, some of the challenges your students are facing, or kind of what's happening on your campus. So Dr. McFadgion, if you want to start and kind of tell us a little bit about what's happening at, is it the real HU? Is that what is that
Yes,
how
yes,
I'm
it
sorry, I didn't
is.
mean to say that. I think we got some
Sorry.
Hampton
Yes.
University people. Sorry to my Hampton people, but the real, the real HU. Oh, it's the Hampton people already in the comments talking about real HU. See, I knew I shouldn't have said that, but we're gonna be all right. But tell us a little bit about what Howard University is doing and some of the challenges you all might be facing right
Yes, it's all love. Thank you for having me. So, from my perspective, from our office, the Office of Interpersonal Violence Prevention, what we've been helping students primarily with is helping them translate the healthy relationship skills that we've taught them on campus in terms of boundaries and having safe spaces to have conversations and conversations around conflict. So we've helped the students be able to understand that what we teach them on campus applies at home. A lot of them think that what they learned on campus in terms of engaging in healthy relationships with one another is dedicated primarily to campus, but we've been helping them translate those issues and address those concerns. But for many of our students, from my perspective, a lot of our students, Howard is a home away from home. And home away from home in a particular intentional way in terms of safe space for them at Howard University, being able to determine who they are and find out who they are. So we provide that safe space for them. And so now they've got to take those strategies and skills that they've learned on campus and apply them at home. So we're helping them with that process.
Thank you for that. Ms. Smith, can you tell us a little bit about what's happening at Alabama A&M University?
Absolutely. We've been blessed to provide a plethora of online programming during the month of April, which is designated as Sexual Assault Awareness Month. We took our SAM month to a virtual platform where we conducted a teal table talk. We did a Q&A with our students. We did a movie watch night that focused on all facets of abuse. So we made sure that we remain engaged with our students during this, very unprecedented times, as well as our medical staff. They're committed to still serving students that have severe illnesses, where they're able to still walk in to the clinic, because we know that we still have local students here in the city. So we've been trying to engage all of our students, regardless if they're traditional or non-traditional students, so that we make sure that they know that we care about them and services are still being provided via telehealth.
Thank you. Dr. Barnes, can you share a little bit more detail or what your health services or counseling services doing at Howard University?
Absolutely. Thank you for having us here. And hello, everyone. Certainly, our university has faced a lot of challenges, mental health challenges. Our students have been faced with worry, concern, indecision, anxiety, depression. It took the family to get you here, our home away from home, and now that's been disrupted. People left for spring break in our situation and were told not to come back. Think about that. You left your valuables there, a lot of your valuables at school on campus, and you can't go back and get them. So we've been connecting with students. Our university as a whole has done phone calls to our student body population, the counseling service, IBPP, everybody's participating and making those phone calls. At the counseling service, our main line is still open. Just as you would dial in DC, that line is transferred to our receptionist, who directs particular calls to our staff. And we have a crisis line that opens up after that main line closes down on campus. And that operates from 4 p.m. to 8 a.m. the next morning, then the main line picks up. Finally, we have the web page that's been altered. So if you go to HU Counseling Service, our web page has been modified to include apps, self-help apps, information about COVID, and information about how to cope. That's largely what we've been doing on our Howard campus, and there's some other things that I'm sure Dr. Fluitt will talk about.
Okay. So Dr. Kennedy, can you tell us a little bit as far as what Tennessee State University is doing to address mental health needs on campus? Oh, I don't think we can hear you.
How about now?
Perfect, there you go.
Okay, so these apparently are not going to work right now. So in addition to our telehealth services to provide direct counseling to our students, we've also been able to translate our signature programs, which focus on general healthy habits and wellness to help students maintain their functionality during this time, and also provide them with a host of coping skills that they need, similar to what Dr. McFadgion mentioned. We've also been able to collaborate with other departments within our Student Affairs Division. to expand on that programming that we've been able to offer through our digital platforms. We've offered drop-in opportunities, and then on our webpage, students can find additional information about general coping. They can also find a behavioral health screening tool that is intended for self-help, and also make some recommendations for different things students can do as a follow-up. And then for students who have been outside of the state of Tennessee, we've also been able to help them connect to local resources to support their mental health during this time.
Thank you for that. Dr. Lundy, can you tell us a little bit about Wiley College and some of the challenges and the responses your departments have had to do?
Yeah, so in terms of the challenges, those challenges have been much like what my colleagues have said, but I think for us, an additional challenge was the loss of a beloved professor who, our institution is small, and we lost a beloved professor to COVID-19. So my colleagues have mentioned grief. Many of our students are experiencing grief, the personal grief they've experienced, but also for us as a family, as a Wiley family, we grieve the loss of that colleague. But in terms of services that we're providing to support our students, and the telehealth, the individual, group, family counseling services that we are providing via telehealth, we've worked really hard to try to engage online, meeting the students where they are. So each week when we were on campus and face, we would do a Wellness Wednesday series where there would be psychoeducation during the day, and then in the evening there would be a fitness wellness movement course. So what we've been able to do is to bring that online. On Wednesdays at noon, we go live with Wellness Wednesdays on Instagram, and students are really engaged. We provide information about coping strategies. We've talked about trauma as it relates to what's happening globally with COVID-19, but we've also talked about the trauma as recent as Mr. Ahmaud Arbery. So like kind of the other collective combined traumas that we've experienced. One of the things we also try to do here at Wiley is be intentional about collaborations as well. And as a faith-based institution, I've been working really closely with our Dean of Chapel here. And so we know that religious coping, coupled with the work that we do mental health-wise, has been a way to assist in trauma. So we've worked hard to try to make sure we bolster that collaborative relationship. And then also, making sure we use the behavioral health screening tools, providing resources. So much of what has already been said, but I think just unique to our campus has been the grief, but really trying to engage, keeping students active via those online platforms. So.
Thank you for that. And then lastly, Dr. Fluitt, your role as Director of Outreach. Can you tell us a little bit about more what Howard University is doing and maybe some of the challenges you had with outreach, and if there are some issues with your students as far as mental health on campus this semester?
Yeah, so as it relates to Howard University, essentially, like Dr. Barnes noted, once we got the note that we needed to transition from brick and mortar to a virtual environment, we really took heed to that. We met as a staff under leadership of Dr. Barnes and tried to figure out the best way to move forward. And so it was decided that we needed to meet the students where they were, and where they were virtually. And so we launched social media pages, something that we hadn't had in the past. We created an Instagram page, a YouTube page, and a Twitter page to communicate with our student constituents. We also started to put together workshops, psychoeducational workshops and events digitally. And so that took place in the form of Zooms, that took place in the form of lives, pre-recorded information, mental health posts, and really just letting the students know that not only were we answering the calls, but we were here for them. So they could see us, they can connect with us, and they could know that even though we're not physically together, we're still very much connected. And we've gotten a lot of great feedback about that, just from students, wanting to know that we were still there, or you all are still answering the phone, or the crisis line is still 365 yearly. That was important to them. So some kind of normalcy amidst a world that feels very unfamiliar.
All right. Thank you. Well, thank each of you for that, for just giving us some insight on what's happening on your individual campuses, because I know a lot of times, not in particular the HBCUs, but colleges in general, we're all kind of dealing with some of the same challenges with students, but a lot of times we get siloed on our individual campuses and we don't always share hear different experiences. So thank you all for just sharing those experiences. So I wanted to kind of jump into, of course, our conversation today, which has all been great so far. But this kind of, I guess, adds on to what you all started talking about initially with those individual challenges that your students have faced from a mental health perspective this semester. So a few of you hit on that in your introductions, but could maybe, Ms. Smith, could we start with you? Could you probably just elaborate a little bit more on maybe some of the individual challenges that your students have come to you as far as mental health this semester?
Absolutely. I would say, speaking collectively with my colleagues as well, the things that we have experienced, a lot of students are suffering with depression, anxiety, and just simple adjustment disorder because they've had to abruptly move from their residential halls back to an environment that for not all students is a positive environment. So they have been very good about reaching out to the counselors on campus. We have a 24-hour crisis line. The IT department was amazing in transitioning our office phones through an app where our students can call us directly. They don't have to go through the crisis phone process. So I think a lot of them just being isolated has been difficult, but we attempt to do our very best with doing daily programming, whether it's a live platform on all of our social media pages or just encouraging words that we post for them daily. But I think the top three issues that a lot of them have stated to us has been depression, anxiety, and just adjusting back to their home environment.
Okay. Did anybody else want to add anything in particular as far as different unique challenges or some of the top mental health issues that your students have come to you with this past semester?
I know from the Howard perspective that some of our unique challenges have been working with our international students. Many of those did not have places to go during the interim because our international students a lot of times stayed on campus during spring break and continued, but they all of a sudden were disrupted, uprooted, and had to find, if they had relatives in the United States or someplace that, a country to which they could travel. Sometimes they were travel bans, they couldn't get to relatives or to their home and then come back at whatever time we would deem for them to come back. So we've been working with our international students and helping them with transportation if they need it. We've helped them with places to stay during this transitional period, food services through Dr. Turner and the housing component. And that has been a particular challenge and from our international student perspective.
Okay. Thank you. Anyone have anything else they wanted to add to that conversation or to that question?
I'd like to add to that in general, in addition to anxiety and just general stress and grief, not just with physical loss, but also with the loss of a primary support, because we are such a family environment within our university. So that has been difficult for students. And I will say just to the loss of sport as well as performance, because we do have a number of students that engage in performance groups as well. Making the change or the transition to online classes has been difficult for some of our students who've had to balance being primary caretakers for siblings and other family members, as well as job loss for them. We think about job loss for family members, but for some of our students who worked on campus or who were working while they were on campus and outside in the community, that was a job loss for them. So being able to help them navigate some of those things too has been a part of what we've experienced. And I will acknowledge a positive for some of what we've seen from our students is their resilience, their ability to adapt in high demand, stressful situations. I don't want to not acknowledge that, because we have seen that from our students, particularly our student leaders, as well as some of our student athletes as well.
Thank you. Really quick, we had a question that came in. This is open to anyone. Are you all continuing virtual programming counseling services since the spring semester is over? Like, how are you all delivering services since the semester is over?
I can speak just a little bit to that and say that, you know, for all of us traditionally during the summer, it maybe slows down a little bit, but I think given the unique nature, I know we've here on our campus felt the need to provide some continued services, maybe a little bit more extended than we would traditionally do. And so some students who are not in summer school, but who are in a difficult place, still providing the weekly individual counseling and psychoeducational strategies, even support groups. I was going to mention that a particularly I think vulnerable population during this time has been our LGBTQIA students. And I think one of the things we do at Wiley is have a weekly support group for those students. And we've been continuing that virtually. And particularly for those students going home who, for their families who may not know, they may not feel comfortable, may not have gone through their coming out process, and then having to kind of reverse or regress in some ways in terms of like their ability to be their authentic selves. And so I think continuing to provide those services is really critical for those students, many of whom say they don't have any other spaces where they can be their authentic self, be vulnerable, and that space that are safe. And so I do think though, on our most recent Wellness Wednesday, we discussed though, when is it okay to take a break? So really being able to think through, although we're continuing the services as clinicians, we want to make sure we're still giving them the best we can. And if we are burnt out and having trauma, so everybody trying to find that balance. But I think being open about the fact that this is a traumatic time, we do want to normalize that we're all feeling intense emotions, but we want to consistently provide support as much as we can. And then if there is a need for a break, because I'm the AVP, but I'm supporting health, but I am the only clinician on campus right now. So meaning to make sure that I am doing no harm and also taking care of myself, and then making sure to provide my students with alternative forms of support, and then coming back, alternative forms of support throughout the summer, but then making sure I'm still accessible as much as I can. So I think what I'm really saying is it's a balance. And I'm interested to see what my other colleagues are doing, but I know we will continue, but we're wanting to find that balance to make sure we are providing the best care here.
Thank you. Anyone else, any other colleges providing counseling services now that the spring semester is over, or what does that look like on your campus?
So, oh, sorry.
Go ahead.
Thanks. From my office perspective, one of the programs that we continue to implement over the spring semester and will do for the summer is our Bison Brothers project. And what that project does is it allows young men or students who identify as male on our campus to go through a series of trainings to become allies in the work of interpersonal violence prevention. So they learn bystander prevention, they learn domestic violence 101, like how to identify those unhealthy relationships, helping them understand what toxic masculinity is and what healthy masculinity looks like. So when the spring semester started, we were right at the beginning of training our second cohort of young men. And when, as Dr. Barnes said, when we went to spring break and we couldn't come back, I wondered about, in terms of what Dr. Lundy is saying, did I need to wait and allow the students time to get acclimated back at home and get their surroundings settled where they could perform well academically? So I was hesitant to keep moving with the trainings. But the young men were very adamant, like, no, you need to create a Zoom. We want to come, we'll be there. So we met and it continued to go well. And then they decided that over the summer that we would just do some, periodic check-ins just to check on how they're doing. And then they want to, once we get back, hopefully into some quote unquote normalcy in the fall, hopefully where we're back on campus, they want to have a meeting again, because normally we would start another cohort. So this cohort of young men that want to learn about domestic violence and prevention and those kind of things, that program continued to take place over the summer. So I was really excited about that.
Wow, that's awesome. Thank you. Dr. Kennedy, you were going to add something as far as what Tennessee State is doing, and then we had a couple more questions that actually went into our next topic as far as returning in the fall. So we'll after you answer your question, Dr. Kennedy, we'll jump right into fall plans for counseling services.
Sure. I just wanted to share that we are continuing to offer telehealth services throughout the summer. In addition to that, we'll be continuing our programming as well. It won't be as active, similar to what Dr. Lundy mentioned, because it is finding the balance for us as well as for our students, but that will continue throughout the summer. So we'll still be identifying ways to engage students through our digital platforms, Instagram, both live and pre-recorded, as well as our telehealth services.
Okay, thank you for that. This actually, a question came in from one of our attendees, but this actually goes right into our next topic. So can some of you talk about considerations for your student counseling centers this fall? If they are going to be in person, if there's a virtual aspect, if your campus is still planning. So can you just share a little bit about maybe what your campus is doing or what have been the talks as far as what your counseling services will look like this fall? And this ties right into a question that came from one of our attendees. That if our campuses are going to have students returning this fall, how are we going to help them emotionally transition, especially for our incoming freshmen that are away from home for the first time, and now they're away from the home from the first time in the midst of a pandemic. So I guess that all ties together with returning in the fall, and then what do your services look like? So do I want to pick somebody? Somebody wanted to jump in? Dr. Fluitt, you want to jump in? Your mic mute. You're on mute. There you go.
I guess what I was echoing. I guess what I was echoing was the fact that transition is occurring, and it's occurring very quickly. And so while we find out what the next step will be.
The baby just won't let you be great today, huh? They just won't let you be great.
I'm going to toss it over to Dr. Barnes.
Okay, that's fine.
So,
yeah, Dr. Barnes, this fall.
That's okay, and we understand. We will continue our telehealth in the fall. So we will make a decision of what clients need to be seen face to face. We will have hopefully in place PPE if we open in the fall. We're going to have particular guidelines for the counseling service for those who we find necessary to come in face to face, such as protective masks, hand washing, cleaning, and so forth. But largely our services will be virtual. We will continue to have our Zoom and Doxy telehealth. We also have telemedicine. We have a psychiatrist on staff who will be providing medication and those related things by telehealth as well. We have worked through a number of challenges to be able to do this. We had to get state by state the guidelines for practicing from another state with the actual client being in another state. And so we're in the DMV, District, Maryland, Virginia area, and we all live in Virginia, Maryland, and District, and so regulations are different, you know, and we've researched each one of those. We have modified our telehealth consent forms, and we have taken trainings on providing telehealth so that we can be within the guidelines. But we plan to be present in the fall, much in the same way that we've been present during the spring and the summer. And that has been with a variety of podcasts, Zoom meetings, and Zoom psychoeducational things. And that's our plan for the fall. We have, we're thinking about doing a special edition on dreams deferred for the incoming freshmen, because I know that I was ready to get out of Frank and Elizabeth Barnes' household and ready to get on campus and meet my people and be together. Those are going to be dreams deferred. So we're thinking about putting on something for the freshmen. Yes, you're going to be away from home. It won't be exactly as you had envisioned in your head. It'll be slightly different.
So is that, would that dreams deferred, would that be like a seminar or a series? Do you all have an envision of what that would look like at this point? Are you still working that out?
We're still working it out, but we are working also with our a freshman committee for the university to be able to incorporate that in their programming as well.
Okay, thank you for that.
And I think that's what I think that, my apologies, I think that's what I was trying to echo, was that even when we transition back into a brick and mortar situation, it's going to be important for us to have connections with our students on all platforms. Because even if an institution decides that they're ready to open up, it does not mean that the constituents or the students may be ready to return. With social distancing protocols, with 6 feet and all the other things that the CDC is putting in place, it's going to be important for us to be able to work with all of our students wherever they are. And so if a student is anxious and not ready to come back to campus because they're not prepared or they don't feel comfortable, then it's important for us to still have workshops and things digitally as well as in person for those students. So I definitely want to echo Dr. Barnes' sentiment. I think at this point, every institution is thinking about what is the safest way to get our students back, and knowing that we are transitioning into a new normal. And so this is not going to look like what it looked like in the past, but it doesn't have to be bad. It just means different.
I absolutely agree with that. And I also think, in addition to making sure we extend or be creative with the platforms and how we engage students, I think it's really important also for us to remember that the skills that we are imparting to them on campus, we've got to be more intentional now about helping make sure that they understand those skills transcend across boundaries, and at home, in their communities, at work. I know we rely, and I guess I speak specifically, I feel like we rely primarily on 4 years, and eventually students, once they graduate, they become big people and adults. And we hope that they have acquired some of the skills they need to be able to engage in healthy relationships with people outside of the campus. But I think because of COVID, that disrupted that process. And so now I feel like I'm going to be more intentional about making sure that when we talk about domestic violence on campus, but we need to also make sure they understand that those same concepts apply to your relationship with your mother at home. When you get home, this is why this is happening, and this is how you create safety plans at home. Because we focus primarily on, here is what you do in terms of safety planning, or if you're a survivor of sexual assault on campus, here are the resources that are available to you. But helping them understand that if I can't get to Dr. McFadgion or Howard support, if I'm somewhere in Texas, let's say, what have I learned already to help guide me in identifying what those resources might be in my community? How do I understand how healthy conflict applies to what my mother and I are going through right now? Because a number of students have reached out to my office, and they preface the conversation with, well, I don't know if this is something you can help me with, but I'm having a situation with my mom. I'm having a situation with my father. I'm having a situation with my stepdad, my siblings. We're not getting along. I'm very frustrated. I'm ready to leave. I'm ready to run away. I have nowhere to go. So helping them understand, well, remember how we talked about boundaries in relationships. You've got to help your mother, if y'all are in a good place, establish some boundaries. So I'm not a morning person. So from 9-11, please don't come and ask me to do the dishes, but I definitely got you at 1 o'clock. So helping them understand that they can have those kind of conversations with their parents, as we would encourage them to have conversations with their partners on campus.
Okay, thank you for that. Dr. Kennedy, I had a similar question because I saw that Tennessee State released a report, I want to say a couple of days ago, on some reopening plans. So I'm just curious the role that your counseling services is playing in that. And I guess I should have said this from the beginning. All of the thoughts and ideas of our panelists are independent of their universities. They don't necessarily represent the college per se. So if they say something a little crazy, then it's not, is it too late now? Yeah, we already 40 minutes in. It's too late. It's too late. Our president's probably watching this. But it's all right, though. But nah, Dr. Kennedy, I just wanted to kind of get your feedback on, since Tennessee State has released a very comprehensive plan for reopening, all the way from a COVID-19 program training and an academy that you all put out. So I'm just curious as far as your counseling services and the role you all are playing in, what are your challenges or opportunities, or what's the status for your services as well?
So some of those details are still being developed by the university, but what we've been asked to do is to plan for if we're fully in person as well as if we are completely remote, and a hybrid of those two things. So that is how we've developed our programming for the fall, as well as our services. We certainly will continue telehealth in that space. It may look different in terms of those students who can continue in receiving telehealth versus those students who are coming in for in-person services. We will look at spacing out appointments differently, and even using some other measures, because we're right now housed with our health services. So we'll need to change some of our protocols to ensure the safety of all of our students, including what PPE we're going to include in that process, as well as some other safety measures to ensure that we are, staying as safe as possible, because we'll have the opportunity right now with our plan to be in person. We will continue with that option, as well as looking at what we'll provide both in our digital space as well as in person.
Okay, thank you. Did anybody else want to add anything as far as your campus this fall, or what are those plans?
I want to add one more thing. We created a YouTube channel during COVID, and it was really fun to work with the students on that. So that's something that we're going to continue to do in the fall to help support some of the trainings that we do in person.
Okay. And I would encourage all of our panelists, if you want to put any of those links or anything in the chat box. A lot of our attendees are asking questions just about some of the services and programming that you offer. So if you all have social media links or links to the YouTube channel, if you want to put that in the chat box, feel free. I think that'll definitely benefit. And Dr. Barnes, you might want to trademark that Dreams Deferred. You got a lot of people saying that's a great idea and they're going to use it. So you might want to go ahead and put that on the trademark real quick. But no, that's a great idea too. I think a lot of people don't think about incoming freshmen and having some type of set aside program, especially if it's virtual for those incoming freshmen. Another question that before we transition, one of our attendees asked, as far as attendance or participation from these online virtual Zoom meetings and your engagement through social media, have you noticed any drops, or is there increases, or what is the attendance like on the live session? I know Dr. Lundy mentioned about live sessions that she does on social media. One of our attendees just asked as far as attendance. And if you are having issues with attendance, what are some things that you all would consider or recommend to try to increase student participation in some of these online platforms? Dr. Lundy, since I know I'm pretty familiar with what you do on social media, you want to kind of start that question?
Yeah. So we've had really great attendance. And I think even when we varied the time of day, so doing something midday, also doing something later towards the evening. But the colleague that I mentioned collaborating with, she has done a lot of work on engaging millennials via digital platforms. And so one of the strategies that she recommends is that we are intentional about the length of time that you're on. So whereas you might typically have an hour-long program in terms of thinking about attention span, you might consider playing around with the time length. So maybe 30 minutes versus an hour. Also, according to her research and some of the research I've looked into, this is also why this idea of taking a break, that student engagement in terms of consecutive weeks looks at about 8 weeks. So whereas we ended the semester taking a pause, so maybe looking at there being a 1 week where we don't do our Wellness Wednesday Live, and we took 1 week break, and then so in doing all of those types of things, we've been able to find for all of our programming that the students have been engaged pretty consistently. But I think it's because paying attention to what their needs might be, and how taking a break, getting rest is important, and really kind of normalizing and reinforcing that has been helpful for our attendance and participation.
Thank you. Did anyone else want to add anything in regards to student participation in your social media or your virtual events?
I think our participation numbers have gone up, because even when we present information live, we do a really good job in regards to recording those live videos so that the students can go back and view them at a later time, because we understand that their sleep patterns are probably way off. So we would assume during lunchtime, oh, they're ready to tune in. They may just be rolling out of the bed. So we do a very intentional job with making those resources available even after the live stream. So yes, I think numbers have gone up. And even those students that are a little apprehensive about walking through the doors of a counseling center, they're able to be a little bit more incognito via the Zoom meetings, via the live sessions. So I think that they're more prone to just kind of peek in there and get the information that they need.
And from Howard,
thank you,
the idea of, we had great participation, but I think that one of the things we've used working with student organizations. We have a number of campus and student organizations, and we were aiming to connect with those organizations to have them make input on mental health needs because they are with their peers. And so we've been able to connect with a number of student organizations to put on programs, and they bring in the numbers. And if she has time, Dr. Fluitt can talk about one we did with the special population, LGBTQIA, this past Monday. But connecting with student organizations is a good way to garner attendance.
Yes, we just did an event with LGBTQIA+ group, and it was on living in a toxic home environment. It was a mental health conversation. And to Dr. Barnes's point, we collaborated with MYTH, which is a university organization at Howard for individuals of that community, which provide them with mental health support, as well as Cascade, which is another known group on our campus that have this population. I thought the conversation went really well, and it's because it was a collaborative conversation. Each of the groups had representation, as well as we had representation from Dr. Jonathan Good, who was our advocate through that group. And so they co-led a conversation around being in toxic environment, returning homes to places that may not be supportive, how to manage it and how to get through it. They talked about self-care and what they're doing in their own homes. And I think to go back to what Dr. Smith talked about, the one thing about the Zoom environment is the ability to be anonymous. And so they opted in or out to show their faces, but you could hear their voices. And so they were still participating in the conversation, but doing it in a way that felt safe for them. And we thought the conversation went really well. We plan on having additional conversations. We actually have another event with MYTH coming up in June. And we recently found out about other organizations at Howard that we want to connect with. So we found that has been successful in terms of our ability to get connected with our student constituents, is going through and connecting with and collaborating with their student organizations. Because we're new to social media as of like March 20th, naturally our numbers have been going up. So, we don't really have anything to compare it to, but we know it's because of the information that's also being put out there. So similar to what the colleagues have shared, if we have an event and it's recorded, we post it. We also have pre-recorded information that's already uploaded by our psychology interns who've been doing a phenomenal job, as well as other staff members. We recently launched a podcast called Equilibrium, which is a men's mental health podcast by two of the doctors in our counseling psychology family, counseling service family, Dr. Isom and Dr. Graham. And so they are on episode 3. And it's on all mediums. So we are finding all ways to connect with everyone and doing so with our student constituents.
That's awesome. Do you mind putting that name of that podcast down in that chat box for us?
I sure can.
Real quick, Dr. Lundy, someone asked, can you talk just a few more minutes about what your Wellness Wednesdays look like on social media? So can you tell us a little bit about what that looks like?
Sure. So I guess my situation is a little different than some of my colleagues in terms of our counseling center had a Twitter and a social media, IG and a Facebook prior to COVID. But in terms of our institution, being a small institution, trying to figure out our marketing and our footprint and ways to reach students the most, our marketing and PR actually transitioned us to focusing more on our primary page for our institution so that our students can go there and know that that's where, like, a centralized location to receive information. So for us, Wellness Wednesday is through our institutional page. So on Wednesdays, our institution goes live, and mental health has been a really important issue that our president here at Wiley College, Dr. Felton, has been supportive of. And so what that looks like is on our Facebook and our IG, Wellness Wednesday becomes the live conversation in collaboration with the students. So there are several students who are wellness ambassadors through our office, and those students have given ideas around what issues are troubling them the most. So whether it's towards the end of the semester, it was accessing their classes on Canvas, which is the platform that we use, much like Blackboard or Banner. And so on Canvas, they were having issues. So what we did was we brought on our academic affairs representatives. So I'm going live with a faculty, staff person, or a student. So brought on an academic affairs representative who talked about how do you navigate Canvas if you're having difficulties. Also brought on our librarian who talked about resources and how students might be able to access different databases as they were trying to write papers towards the end of the semester. And then on another live, we brought on the seniors. So it would have been their senior week, and we brought on several seniors, and they, that ranging from our incoming SGA president, outgoing SGA president, and then also looking at Miss Wiley came on, and we had a range of students who came on just for a few minutes, talked about their experiences, and then we took questions. Always a part of Wellness Wednesday is taking comments, engaging in the comment section. And as I mentioned, my colleague who's in religious, the dean of our dean of chapel, she also assist, and often we end with a wellness strategy or a prayer. So prayer, because of collaboration, much often when she's there, we may incorporate prayer, religious co-praying, but not always. So most in our last three, we've been doing deep breathing exercises at the end. So it becomes psychoeducational, resource opportunity, and then we end with a strategy that students can take with them to help regulate their emotions or what they've been feeling, and then always offering information about ways to stay connected throughout the week. So those are, hopefully that was a little bit more context, and hopefully it was helpful.
No, that was great. Do you mind putting your school social media information in the chat box so that way we can all get our followers up? We are trying to get our follower game up. So
yes,
yeah, go ahead and put that down there. But real quick, I did want to, there was a question that came in, and this question can probably be a whole nother like hour. But like, what are you all doing as far as mental health professionals? Because you all are constantly pouring out and pouring into your students, but how are you all taking care of yourselves during this time? How are you taking care of some of those self-care techniques that we employ our students to do? What are some things that you can recommend that other mental health professionals can do during this time? And that could be a whole nother webinar. I know it can. But if anybody just wants to just add a few, quick little tips or just some feedback on what recommendations you have for other mental health professionals during this time.
Right off the bat, I would say there are a few things from eat well. Keep your nutrition in mind. I've had the opportunity to cook things that I wouldn't ordinarily cook and be healthy because I'm not on the run, moving from one office to another or one meeting to another, so that I can eat better, nutrition-wise.
So Chef Barnes, that's what they're gonna call you in the fall, Chef Barnes?
Well,
Chef Barnes.
Hopefully I'm gaining those skills later in life. And exercise, I walk anywhere from 3 to 4 miles each evening after I finish all of this. And I didn't do that when I was working, so I have time to do that. And establishing a routine, and allowing myself to leave that routine every once in a while. And finally, just some mindfulness, deep breathing. I have an opportunity to sit and concentrate a little bit more. So those things I found helpful.
Okay.
I think in addition to managing teleworking, for a lot of us, it's home balance. So a few moments ago, one of my little ones came in and tried to be a part of the conversation. potentially probably because she didn't want to take a nap. But I think really just being mindful that while we're in the national pandemic, life is still happening. And so while we've been able to separate our personal lives and our home and our work lives, we can't do that. It's just not feasible. We're at home with our families. And so some of the ways that we stay connected is cooking together. To Dr. Barnes's point, we have the opportunity to do a lot more than we've been able to do in the past. So we are able to connect with each other and do family walks and things like that. But I think also just allowing yourself the space to feel everything that's happening, not only to you, but and through you, because you're being used as a vessel to help others, but also just being mindful of where you are and making sure that you're attuned to your own mental health, right? I think one of the favorite quotes that I have is, you can't pour from an empty glass. And as we continue to pour and pour and pour, at some point we become empty. And so finding ways to replenish yourself. So for me, that is my connection with my greater power. That is my connection with my family and my friends and people that really give opportunity to pour back into not Dr. Fluitt, but Kelechi. And so that's how I maintain my self-care.
All right, thank you for that. Anyone else want to add anything? I'm sorry, go ahead, Ms. Smith.
Okay, yes, I wanted to add that everything that they said is phenomenal. I totally agree with taking those measures to kind of decompress. But I think it's important as mental health professionals is to have a great escape. And what I mean by that, it's okay to have fun. Things that I typically can't do when you work an 8-to-5 job. I am an urban novel junkie, and I love to read series. So
urban novel? Can you give us a definition of urban novel? What is a?
Mind your business, Dr. Griffin.
Oh, okay.
But no,
Okay, my bad.
But no, I'm a major Ashley Antoinette, Jaquavis Coleman. They're my favorite urban novel authors. So I pretty much knocked out a 6-book series in like 3 days. So it's good to have that. Everything doesn't have to be so serious. Everything doesn't have to be so uptight. That is how I escape from the real world. So I don't, have those things that I discuss with my patients on a day-to-day basis seep into my mental and pour out through my home. So me having that great escape has been phenomenal. It helps me to reset, to readjust. As Dr. Barnes said, I've been really actively practicing guided meditation. I actually did my very first one that I'm going to launch out to our students. And it was just so amazing. My kids thought I was crazy. They were laughing at me and wouldn't participate. But it helped me ground myself and to just reset.
I love Great Escape.
Yeah. I want to piggyback with Ms. Smith. I'm glad you said that, because this is a no judgment space. So nobody has to admit, but I know everybody done got into those raunchy Netflix series or those things on Prime Video. Don't raise your hand. It's okay. But that's look. So that's something that I'm doing. I still love cartoon movies. So my daughter and I watched Maleficent last night, and it was really amazing. I was agitated. Maleficent didn't get to kill nobody. So just having those thoughts that are not okay to have in a private space. But like Ms. Smith said, just let yourself loose and watch little fires everywhere. I'm not pubbing anything, but just let go and have a great time. I absolutely agree with that.
Appreciate that. Thank you. So we only have a few more minutes here. We might go a little bit over, but we want to try to respect everyone's time with this conversation. But I did at least want us to hit on the mental health disparities that exist. And we know that HBCU serve majority African-American student populations, and we know it's no secret that COVID-19 has disproportionately impacted communities of color, especially Black communities. So I guess I want to know, what role do you see HBCUs playing or having in addressing these mental health disparities, both short-term and long-term, especially in the cities and states that have been most impacted, Washington, D.C., in Alabama, Atlanta, just different areas across the country. What role do you see HBCUs playing in addressing these health disparities from a mental health lens, both short term and then maybe long term down the line once our students do return to campus?
I know I just spoke, but I want to answer that really
No, that's fine. Go
quickly
ahead.
because I was on a webinar yesterday where some individuals were sharing their research on health impact or health outcomes of rape. And so they're going through the presentation and they start talking about these health disparities. And so I'm continuing to listen, and they never address the fact that there are health disparities among certain racial groups. So I asked, well, did you, analyze race? And it's like, oh, no, we controlled for race. So for those that don't know what that means is that they knew that there was an influence with regard to race, but then they controlled so it wouldn't have an impact or intersection into the relationship between health impact, health outcomes, and rape. And so I was very angry, and I was very excited that this question was on our list, because what HBCUs can do is continue to do what we do at Howard. We partner a lot with other offices, the Student Health Center, the Counseling Center, the Residence Life, and so continue to engage in partnership with one another and create those programs that are created by us and for us, honestly. And then I think we need to push ourselves a little bit more to present some of these programs and paradigms that we have, so that other folks know that when you have already a population of people who have health disparities with regard to asthma or diabetes and high blood pressure, and you know that if a survivor is living in a relationship where there's domestic violence and he or she might not be able to take high blood pressure medication or address their asthma, that it's absolutely going to influence their health outcomes.
Here, and just to piggyback on that, short answer is disperse knowledge. We have relied upon our own with African American newspapers, etc., to disperse knowledge in the immediacy, and in the long run to mobilize persons in our community. One of our missions at Howard is to train students to be leaders in the community and the world.
I think HBCUs have to continue being pioneers. We have to continue advocating for our needs. And advocating for our needs is exactly what both Dr. McFadgion and Dr. Barnes noted, and everyone else has noted, the importance of not only dispersing the knowledge, but advocating for our needs and getting more allies. That is the only way that we're going to be able to continue to get our students what it is that they need. The reality is we know that the data is skewed. We know that people don't want to acknowledge the disparities that happen amongst people of color, because that means that they should do something about it. But people don't want to do that. And so it's easy to sweep it under the rug. It's easy to control for it so that we don't have to acknowledge it. So we need to advocate. We need to get other allies that are not of color to advocate for our needs also. We have to continue saying it and saying it and saying it until people are willing to hear it.
Thank you. A couple more questions that came in from the panel or from the attendees before we jump off. For your students in recovery, those recovery programs, do you all have any recovery programs on campus? Or are there any students that are having those challenges with addiction? Are there any programs that you all have that were on campus and now that you had transitioned to a virtual option? Anybody want to add anything as far as about students in recovery?
We actually are working on partnering with community agencies so that our students that are in recovery can attend the AA and A meetings. We also have groups for those students that are in recovery that we are working on implementing the fall semester, maybe through a virtual platform first. We may roll it out that way first. And then, when things are safer for us to congregate together, then we will have group sessions, because we do understand that college is a very experimental time for most of the students. And a lot of times they slip into addiction accidentally just from, thinking that they're having fun with friends. So we are very aware that students may suffer from addiction. So we want to make sure that we support them in all of our things that we do on campus.
Okay. Thank you for that. So we are at the top of the hour. And like I said, I know we can probably go on and on and on, and that just shows how much needed these conversations are. But I thank you all. Sincerely to our panelists, to our attendees, for joining us today, for sharing your insight and this valuable information. I am pretty sure that our attendees gained something today. And as I was watching the list, this webinar holds a max of 100 and we were at 100. So as you can tell, that is a much needed conversation. Once this webinar ends, you'll see a pop-up for a survey to give us feedback. So please, all of our attendees, please take that brief survey to give us feedback on what you thought about the conversation today, maybe some topics that we didn't cover, or if there are any additional questions you might have, please add those in the comment section, and we'll make sure to give these to our panelists so that way we can follow up and make sure you all have the resources you need. Again, thank you all again for joining us. It was a pleasure, and I wish you all the best and continue to stay well. And sincerely, I want to thank all of our mental health professionals, both our panelists and our attendees, for the amazing work that you do to support our HBCUs, to continue to be on the forefront of addressing these needs and closing these health disparity gaps and ensuring that our students have the resources and the support that they need. So thank you all again. Hope you all stay well and have an amazing day.
Thank you.
Thank you.